us, because this will give a message straight to the general population through you that this is a small setup, but we can do high and complex cases also, right? Uh, as we continue to innovate and raise the bar in healthcare delivery, I would like to thank our dedicated team and the stakeholders for their valuable contributions. Together, we are building a legacy of trust and excellence, which you can definitely see right now when we are sitting in front of you and we are discussing it out loud and clear. Thank you once again for being here. I am happy to address any questions if you have. Thank you. Thank you, everyone.
Yeah. Yeah, I've got one. You will be completing the success rate will be so high.
It depends on the experience and how much number of the cases, because this type of case, but she was older than this lady. We have done in previously, and we were expecting that this would be giving her a better result, and it would be a painless and mobile kit, which she is very happy with it.
Okay, I would like to ask Mariam, how did you find out about Apollo, and how did you have that confidence that this hospital is the one worldwide? I mean, because you're from Kenya.
This hospital was recommended to me by my aunt, and I did some research on Google, on the website, Apollo website. I saw that Dr. Fiyuddin had 13 years experience, and I was convinced that he would help me.
Great. And now that the surgery is over and you are able to walk, you are able to feel confident that now this is the right surgery that has gone through. And what are your dreams and goals that you want to fulfill now that you have become all right?
I want to be able to do my daily activities that I used to do before my surgery 4 years ago, and yeah, I want to be able to do everything normally again.
Doctor, now that you have fixed this, how about sometimes there is a rejection of the body for different materials which come in?
Yeah, we have already kept her on antibiotics to take out any, take care of the infection and other problem, because it is a secondary surgery. So till now she is doing well, and we have given her all the instruction, and my team is there, and my junior doctors are there, who are in touch with the patient. If any problem is there, anything is there, so they can coordinate with the patient, and patient can also coordinate with the doctor, and even she can coordinate with me also. And there is our excellent rehabilitation physio center department, who are also looking after the patient to develop the muscle and release the stiffness of the muscle. So every day she is improving, and I hope she will do much better with this.
Great. So on a short-term basis, you said 3 months she has to take medicines and everything. How about long-term? Supposing after, let's take 3 years, 4 years, when she's completely all right, what care she has to take?
Long-term, only one thing which I have recommended her to lose the weight, because she, at her age, the weight is on the higher side. So this is what one recommendation is there. Otherwise, she will be doing excellent. I hope there will be no problem with this.
Doctor, my question is, what precaution one is to take to prevent osteoporosis?
Yeah, the precaution which we tell usually the people to have a proper sunlight exposure, have a proper vitamin D3 analysis, and have a calcium intake, that is milk intake, egg intake. If anybody is taking who is a vegetarian, and they can take egg, that is much better, and fish, that must be included in the diet. So most important thing is that daily intake of milk is important thing. If you are not taking milk, then you have to take a supplement of the calcium.
In earlier days, when such a hip joint operation was being done, so most of the cases there was a leg, like the length of the leg used to deter.
Yeah, your question is that earlier there was limb discrepancies used to be there.
Right.
So that is what is with newer implant and newer technique, that thing has been minimized with this.
So now most cases are precision. There is precisionness in most of the cases now.
Obviously, because this has helped us, because we have a better templating, better pre-surgery plans, and on intra also we are in a better position to place the implant and get a better result.
And after the operation is conducted, how means the patient in what time is discharged nowadays?
Usually we discharge on the second day, but for this patient we have to wait for 3 to 4 days because we have to give antibiotics, and the surgery time, it took little time because to remove this screws. Usually when we do a primary hip without any redo surgery, if it is a primary hip replacement, we discharge the patient on the second day. There is not an issue.
And the material which is used for the hip replacement, so does it last long? There is no need of
Obviously,
resurgery.
This is the one important part which was there on my slide. The most important and challenge for this young age patient is the survivorship of the implant, like how long the implant is going to survive. So usually in our data, in our presentation and journals which are being presented all over the world, and our experience, it shows that around 15 to 20 years it goes on. So it can go further if the patient is able to take care of herself.
Thank you.
Sir, regarding the hip implant, is it this kind of rare surgery which is there? Is the implant affordable and accessible? And second thing is that there are 2 lakh joint replacement surgeries done annually. Out of that, how much is Apollo doing, and how far the Apollo can do it? And do we have the self-reliance in terms of?
We have the joint registry data with us. So we are doing on an average every month 14 to 20 joint replacement at this center. So all over Apollo, like Apollo Chembur is there, Apollo Belapur is there. So those people have different data with them.
So India is equipped to handle such cases like joint replacement.
Obviously, now
the demands like
now we are doing in much better replacement. That's why the people, they come from outside, especially from the Middle East, from Africa and other part of the world also, they come to us.
Hip implants, are they affordable, accessible? That's my last.
There are different varieties of implant are there, but for her, what we have used is the best implant, that is Johnson & Johnson. So that is the best hip implant till now. And there are other companies also which are manufacturing. But for a young patient, as per our experience, this is the best implant.
Sir, is it like, what is the cost factor? Like, is it affordable?
Yeah, obviously we
Because here in India it comes under the scheduled category.
Yeah, it is there under the scheduled category. It is there. It is affordable only.
What would be the cost?
So it depends on different implants, like what type of implant. Like sometimes it depends on the surgery. If I use the cup, I use maybe some extra plates, maybe I use wedge. So those all implant cost, it goes up, and it can come down also.
Thank you.
Every patient has different choice of implant, and the plan of the surgery is also different.
सर जी, ये ऑपरेशन के लिए क्या कितनी डिफिकल्टी थी ऑपरेशन होने के लिए, और मरियम अभी ये ऑपरेशन समाधान है क्या?
ऑपरेशन डिफिकल्ट इसलिए था कि ये पेशेंट बहुत यंग है. यंग पेशेंट में हम लोग हिप रिप्लेसमेंट या नी रिप्लेसमेंट जल्दी नहीं करते. वो इसलिए नहीं करते कि 15-20 साल तक हमारा जो इम्प्लांट सर्वाइवरशिप रहता है वो बोन के साथ चिपका रहता है. वो फिर बोन गिव अप करने लगती है. जैसे साहब ने पूछा था कि क्या ऑस्टियोपोरोसिस का ट्रीटमेंट क्या है. फीमेल्स में अर्ली ऑस्टियोपोरोसिस बहुत जल्दी हो जाते हैं, तो वो एक रीज़न रहता है जिससे इम्प्लांट गिव अप हो जाता है. तो उसके लिए हमको रिवीजन करना पड़ता है. तो ये एज में हमने पेशेंट को भी समझाया है, उनको बताया भी है कि आपको अपनी डाइट लेना है, अपना वेट कम करना है, अपनी एक्टिविटीज़ क्या क्या करनी है, वो सारे प्रोटोकॉल्स हम इनको पेशेंट को बताते हैं, सर्जरी से पहले भी, सर्जरी के बाद भी.
आपके यहाँ पे सुविधा क्या क्या उपलब्ध है ऑपरेशन के लिए?
यहाँ पे तो सारी सुविधाएं उपलब्ध हैं जो एक प्राइमरी सर्जरी के लिए है. ऑलमोस्ट एवरी सब इक्विपमेंट यहाँ पे है ऑपरेशन थिएटर में. हमारे पास 4 ऑपरेशन थिएटर है और चारों ऑपरेशन थिएटर इट्स वेरी इक्विप्ड.
And what are the other facilities in this hospital, and can you elaborate something about the hospital?
That I think Ashfaq will be better person to answer that.
To answer your question, sir, Thank you very much, because you should understand what kind of facility you are setting into. So this is around 15,000 square feet hospital. It's a very small sort of setup, but it was very complex and well-to-do setup. As rightly sir has shown in the PPT also, that we have robotic available over here. We have around 24 beds, 4 modular OTs, 4 bedded ICU. So whatever is required for doing any kind of planned surgeries, we are very well equipped with those equipments. In fact, we have latest equipment for all kind of surgeries, like you must have always heard about laparoscopic surgeries, the keyhole surgeries. We can do that over here. We can do urology, high-end procedures also, end-to-end procedures in urology, general surgery, ENT, spine, orthopedics. So all these surgeries are more of the time are planned cases. So we are aware of what kind of requirements are going to come, and we are very well equipped with all those things in this smaller setup. So normally investigation wise also we have X-rays, sonography, whatever basic investigations, we have our lab over here. So all blood tests are done in-house. So whatever is required for secondary care is available under one roof. So you don't need to have a big hospital, a big picture kind of a thing. Everything can be very well managed in this setup.
Thank you.
Thank you.
एक विजुअल हो जाएगी